Now we're on the part of the program where all of you get to participate. First of all, thank you all for coming. I hope this meeting inspires you, and whether you speak tonight or not, that you feel more connected to the legislature and more prepared to advocate. We're most concerned about your personal experiences. What have you experienced with the mental health system, and whether good or bad? Let's share that.
My name is Linda Friedman. I'm 61 years old, mother and a single parent of 2 adult children, a daughter who is 36 and a son who is 28 years old. For over 34 years, I've worked in the field of mental health as a social worker. Like most of you in this room, I have a story to be told. My story began with the birth of my son, Danny. During my 28th week of pregnancy, an emergency C-section where I was cut both ways was how my 3-pound baby boy entered this world. Several days passed before I was wheeled down to the NICU to see my son for the first time. As I entered the unit, the head nurse asked if Danny was my son. There were 2 babies in the room. One was black and one was white. My son had wires and bruises all over his tiny little body. The head nurse offered some advice, saying, if I were you, I'd pull the plug. We live in a perfect world, and he isn't perfect. It will cost thousands and thousands of dollars to raise him. He will be a vegetable. I called my doctor. He said, get the name of the nurse because she doesn't know what she's talking about. You have a perfect son with 10 fingers and 10 toes. Since his birth, Danny has undergone several surgeries, including an ASD, high drops that 1 out of 5,000 children can have, spinal fusion requiring 2 rods, 6 bolts, and a hip fused, 2 hernia surgeries, and 14 surgeries to put tubes in his ear. My son almost died with each surgery, but he is a survivor despite his many challenges. I've been an advocate for my children, parents, and patients. I've seen the mental health field at its best and at its worst. As such, I've experienced and understand just how much energy and sacrifice is required to make the world a better place for the underserved, especially those who are underserved and living with a different ability. As an advocate, I set my mission in life is to help others. However, over the past few years and days, I've had to accept a harsh reality. That is that now I too need help. My parents are deceased and my daughter lives out of state. Whereas once I had their support and help, accessibility, I am now alone. While I am blessed to have good genes, the truth is I simply can't do it all. I have no CLS, no respite, and my adult son lives at home. I've worked very hard with many people to create a world of opportunity for my son and others with special needs, yet as the need for respite and other services have increased, mental health funding has continued to decrease. There is an outstanding demand for trained caregivers, staff, to care for one of our most vulnerable populations, which includes many loved ones to those here in this room tonight. Compensating minimal wages with the expectation that the highest level of care, attention, and respect will be given to lives within this vulnerable population is insulting at best. While Myers, Target, Costco, even McDonald's compensates their workers at times double the minimum wage, what message does this send to job seekers? That those providing retail and hospitality services in our community are valued more than those providing care to members of our community? How many of us would want more responsibility for less pay? What's the incentive to do better or provide exceptional care? Unfortunately, raising the bar for standards of care cannot exist when the cost of living increases. Here's the proof. My son moved out of my house a year ago, despite many years of planning for the dream to become a reality. Danny and his 2 roommates' home had no designated house manager for months. Not only had staff reported not been trained appropriately, several also reported that they themselves had no support, were working double shifts, and being called in on days off due to staffing shortages. This revolving door of staff was made up of individuals, including one man who showed up for a shift under the influence of marijuana, a woman that had called in sick more days than she actually worked, one woman didn't like to go outside So the roommates and my sons would stay inside. Another staff member bumped bedtime up to 6 p.m. and wouldn't take my son to scheduled activities that required registration and payment. You could find meds all over the house, but you couldn't find a copy of Danny's PCP. Then, on September 14, 2014, my son was attacked by one of his roommates. With all alternatives for housing due to budget and funding cuts paired with a shortage of staffing, my son and I have both experienced the repercussions of these cuts. I still have no CLS or respite help. I've begun to go into my savings to pay for the care out of pocket so I can go to work to help my patients with mental health concerns. Saving funds that were intended as support for my son's quality of life after I'm gone. Those saving funds are decreasing also. My son wants to be independent again and live out in his own place, like he saw his sister do when she was his age. Being independent gives a purpose to Danny's life, and he deserves and is entitled to the right to live that life. I have not been able to work the hours I need to. I've gone into my savings to care for my son. My greatest fear is what will happen when I am gone. Who will care for my son? I've been in many meetings to help my son and others, but the ending is always the same: budget cuts and no money. I question what is meant by properly funded. As long as I am here, I will continue to educate and create a better world for our most vulnerable populations. Thank you.
Thank you all for coming here. I didn't know that this was going to be a town hall where you can speak. I've never participated in anything like this before. So I'm kind of working off my emotion, which is getting the best of me, because this is something sentimental to me. I'm in recovery from chemical dependency. I've got 9.5 years from addiction. I've received community mental health services as a teen. When my parents got divorced, that's when my addiction started and got to the point of me trafficking and distributing drugs from New Mexico to Michigan. DEA wanted to give me a pair of matching bracelets, which I wasn't too fond of. And in January of 2007, I became a person in recovery through accepting a higher power of my own understanding. And it's been an interesting ride. It's been a lot of emotion, but I've done it sober. So recovery is possible. It can happen. What I primarily came here for, after hearing about the funding concerns and whatnot, is to talk about my job, which, thank you, Willie Brooks. I work at the RISE Center. It's a free, yes, free, capital F-R-E-E, community resource for case management and peer support. My case manager, her name is Alyssa. She's got a bachelor's degree. She's working on her master's. I'm the certified peer support specialist, which is a mental health certification through Michigan Department of Health and Human Services. And I'm also a certified recovery coach, which MDHHS will be taking that over in October. I just wanted to let you guys know, and women, and who's ever watching online, that there are services that are available that are free. We don't have all the answers, but we at least have something to move someone along, to give them even a shadow of hope will ruin the darkness, or a flicker of light in a dark place will ruin that darkness.
Thank you. I am Sue Serlin. I am on the AMI committee and the board. I'm on several boards. I am an author, and I have pioneered organizations in this area. Today is the anniversary of my son's death. September 22nd, 1998, my son, who was 31 years old, died of suicide. It was several years ago, but it could have been today. While we have progressed in some areas, in my opinion, in my experience, in doing workshops and support groups, we have scaled only the perimeters of success. Suicide is on the rise. No surprise to anyone in this room. and mental health has a long ways to go. First, let me share about the tragedy of a psychiatrist administering drugs to patients that they may not really know. Medication did not work for my son. He would see the psychiatrist for 20 minutes, share that he was a zombie, or that he was so high he felt totally out of control. Within 15 minutes, the psychiatrist would increase, decrease, or change medication. The questions were brief, and the session ended. This is years later, and I hear the same stories. The medication gave Joel terrible side effects. He would call and give his reactions. He was lucky if he saw the psychiatrist, 2 weeks later. I know of a few psychiatrists who actually give therapy or have team collaboration. The consequences were Joel couldn't think straight. He was in school and he wanted to be out of the house. He didn't trust himself to be alone with himself, and he was in therapy both here in Michigan and Iowa. He was committed 3 times. Commitment meaning he would call me and he would agree to have the police take him for help. I talked with Joel twice a day. He would be in the hospital for 2 days or a weekend. At the end of the weekend, it was time to leave. Twice he left without a plan of action. I begged them to keep him longer. I hear the same stories today. Joel was in the private insurance system, not an HMO, and later he was on SSD. In the private system, he did have some excellent care, and therapists were determined by Joel and myself through research. That's truly private, not an HMO. When Joel was on SSD, he went to a public hospital being suicidal. He was let out and attempted suicide within the week at a friend's home. The consequences often are the desperate, helpless feelings, the fear of oneself, and the death of creativity, talents gone sour, and the loss of a human being. It affects the entire family. All of you know how, and my children were afraid that maybe they would be the next ones to be suicidal. And then there was another Joel. Joel Serlin was in a bachelor's program in the School of Writing. He was honored to be transferred to a master's special program for published authors and serious writers. This is many of the Joel Serlins. Our son was not dangerous. What about the ones who take their rage out on innocent victims? We not only need to not delete the mental health budget and place the money elsewhere, we need to add to it. Let's talk about HMOs. For whatever reason, I have dealt with a lot of very serious mental and physical challenges within my family. My other son had juvenile rheumatoid arthritis at 6 years old, and I could go on both sides. HMOs, as I know it, the internist is the gatekeeper. We see an internist for maybe 20 minutes. If a referral suggested by the patient or family is denied, the patient does not receive the referral unless homework has been done and the person speaks up. Can a person who is severely depressed speak up and be his own advocate? It is not just about medication. What about transportation? What about day programs? In a moment. What about thinking outside the box? I tailored this down several times. What about therapists who specialize in prevention of suicide? What about where they live? What about having home care to make sure they take care of their medication? How much can you make and turn us responsible for before you make them irresponsible? How many referrals are they allowed to make? My request is to evaluate the present system, look at its strengths and weaknesses, look at the solutions, have people who have used the mental health system on your panel, and make accountability for everyone a must. The legislature needs to be accountable. Let me just have one sentence left. The system needs constant monitoring. We won't save everybody. The stakes are huge. Are you going to be part of the problem or part of the solution?
Good evening. Thank you everyone for being here. And I want to share a small part of my story. My name is Pam Casper. Sorry. Part of my problem is anxiety in addition to depression. I receive services from community network services and our house clubhouse.
With your peers.
You're all right.
Sorry.
You're doing well.
Come on, Dan. You can do it. Come on.
So just gotta get her breath. Just gotta get her breath. We got it. Hi, I'm Joyce Rupp, and I've had the privilege of working with people with mental illness for almost 30 years, even though I know I look really young, but it's just a child. I work at the Dreams Unlimited Clubhouse, and that's a program of Easter Seals funded through Oakland County Community Mental Health. And just today, we were scrambling around writing letters, and no, I'm not going to read all 17, but we do have 17 testimonies. But I chose one to read that's shorter, but I think that kind of captures many of the things that were maybe that haven't been said yet. And then a couple of members of our clubhouse will be speaking as well a little bit later on. But this particular person, her name is Joanne, and she said, I'm a resident of Southfield. I have lived in Michigan all my life and have several family members in and around Southeast Michigan, including my dear brother with mental illness. And this individual is one of our members as well, so has mental illness. In fact, I am also a consumer of mental, as she said it, consumer of mental health services, having had a nervous breakdown at the very tender age of 11. I am now 53 years old. In addition to a diagnosis of schizophrenia and bipolar disorder, I also have cerebral palsy and mild mental retardation. Because of these services I have received over the course of my life, I have been able to be a productive member of society. Working on the same job for 27 years this coming January. I belong to a mobile cleaning crew, cleaning apartment buildings in Farmington Hills. In other words, I'm a consumer of mental health services, but also a taxpayer in the state of Michigan. And I don't like it when I hear that I and my fellow consumers may lose the services that we need to survive. It makes me angry, sad, depressed, and anxious to hear that so many mental health consumers who have been doing so well in their recovery are now being told that their services are being terminated and they must find their other resources in the community. Guess what? Those resources don't exist. Programs that provide a bundle of services such as psychiatrists, case management, individual and group therapy, day programs like Clubhouse and vocational rehabilitation exist only in a publicly funded system. So many of my friends are concerned they will end up back in the hospital or worse. Please don't take away the funding or move it over to the private Medicaid HMOs. Lives are at stake.
Okay. I do want to thank Representative Kesko has come to our house clubhouse and actually got to know some of us
Coram Anderson.
From personal experience, I know how important the public mental health system is for individuals with serious and persistent mental illness. I receive services ranging from assertive community treatment, case management, peer support, clubhouse, and other services. They have literally saved my life. Without the services that I received through community mental health, I would have died by suicide. Previously, I was employed as a registered nurse, and I had health insurance through my employer. In 1996, I had a severe episode of bipolar depression and required outpatient treatment and several hospitalizations at a psychiatric unit. Despite receiving treatment from a private psychiatrist and private psychotherapist, my symptoms increased. My depression, my anxiety, and my panic attacks were even worse than what you saw. The psychiatrist had a very difficult time trying to find an effective combination of medications to treat my symptoms. This resulted in several medical leaves of absence. My last medical leave of absence was without pay. Eventually, I had to resign from my position because it was not known if or when I could return to work. I exhausted all my savings. I cashed in my retirement plan. It didn't take long to become financially destitute. I was on the verge of becoming homeless. My depression and anxiety spiraled, and I attempted suicide. Subsequently, I was referred to Oakland County Community Mental Health Authority. I was authorized to receive intensive services. And these services were sort of community treatment where they saw me at my home. They were available 24/7. The case managers helped me apply for Social Security disability benefits, Medicaid, and food stamps. They linked me with a program that subsidizes my housing. These services literally saved my life. After receiving ACT services for several years, I became stable enough to be transitioned to a less intensive case management program. During my lifetime, I've had about 16 psychiatric hospitalizations. I have not had any psychiatric hospitalizations in more than a decade. Because of the services that I received. Traditional mental health services were not adequate to help me. It was the specialty mental health services that literally saved my life. I'm grateful that even though I wasn't eligible for full Medicaid, I was able to receive the specialty mental health services I need. Please make it a priority to properly fund the public mental health system. Thank you.
Hello, my name is Susan Hatcher, and this is my husband, Doug Hatcher. We are the loving parents who had hopes and dreams for the future of our son, who is now age 38. To our shock and dismay, he developed severe mental illness and bipolar disorder in his early 20s. As a result of this impairment, he made poor choices resulting in risky behavior while going undiagnosed and untreated. With his mental illness raging out of control and untreated, our son committed several non-violent crimes. Professionals believe that he committed these crimes in order to self-medicate. Since we were inexperienced parents with the disease of mental illness and bipolar in particular, we tried every possible means to secure help from many different organizations and agencies, even going so far as to encourage our son to complete the adult treatment court program supervised through the Honorable Joan Young, which was regrettably and unsuccessful and disastrous. Due to the nature of his illness, he could not comply with the rules that were enforced and required, such as maintaining regular employment and providing rent for an apartment as well. Our son lied to the probation officer about working and losing his job because he was afraid of the court consequences. It was during this time that his probation officer charged him with a probation violation, and Joan Young imposed the original court sentence and put him in prison. While in jail and prison for 18 months, he went untreated, without medication, and his condition was worse than ever after being released. As a condition of his release from prison, he was ordered by the parole board to get and receive proper mental health treatment. Since our son was without health insurance and had no income, we were instructed to contact the organization called PACE, who denied him the funding for any mental health treatment, even though it was a condition of his parole. During this time, our son severely floundered, and it took his parole officer over a month for PACE to accept him and eventually refer him to receive help through the organization of CNS. After trial and error with many different medications, we found that lithium and Wellbutrin have kept him more stable and suppresses the need for him to self-medicate. Since he committed nonviolent crimes during this time, his mental health issues were untreated. His past activities have prevented him from securing safe and affordable housing through using his Section 8 voucher. We have tried unsuccessfully to find an apartment that would take Section 8, only to find one apartment in a 2-year search, and then found out he would be denied because of his criminal background. Finding an apartment that he would qualify for and in a safe environment is next to impossible, as most apartments would not accept Section 8 vouchers. We have reached out to legal aid and advocacy groups only to be told there was a cut in funding and he wouldn't qualify anyway due to his 2 felonies and 3 misdemeanors. The advocacy group suggested he appeal any denial from any apartment complex, which could take years. As parents, we are wondering what can be done to help our vulnerable son and disabled people like him who commit nonviolent crimes before being diagnosed and treated. We are appealing to try to get some kind of legislation or amendment of a bill to help people like our son who have committed these nonviolent crimes to obtain housing that would allow him to live safely and independently with help from his small SSI income. We find that the resources available are extremely insufficient. There needs to be a greater effort to provide better mental health services, both through organizations like CNS or New Oakland Family Services for the good of our community. There is also a great need for private psychiatrists and therapists who now refuse to take Medicaid. We greatly appreciate any help or suggestions you can do for us in our time of need from the bottom of our hearts. Thank you.
Please don't count this against my time, Fred, but I want to point out to you the person that I think is the bravest person in this room tonight, and that's Pam Casper. I've known Pam for, I don't know, 8-10 years, and she, over that time period, she's a tireless advocate for people who struggle. She never quits, and why I say that she's the bravest person in the room is because you saw right here tonight the great challenge and difficulty that she faced, her panic, her fear, her anxiety, and she pushed through it and she came back up and she finished. So I want to tell you, Pam, don't you dare go home tonight and feel embarrassed because you cried. With that, sneak in. My name is Bob Gilliber, and I've been around for a while. Let me tell you why I'm qualified to speak here tonight. For 14 years, one floor below, I conducted a twice-monthly support group. 300 groups over these years with around 5,000 people with mental illness attending. They often spoke positively of the help they received from the mental health system. Sadly, however, during that time, We lost 9 people to suicide. Personally, I benefited from those services for a decade and a half, and I can tell you this without question, had it not been for them, I would not be here tonight. Because of this background, I felt implored to show you what will happen to our mental health system if the politicians who control Lansing succeed in privatizing it, you excluded. To that point, I'll point out their big lie. But before I do, please indulge me. Got a $10 bill in your wallet or purse or any kind of a bill, pull it out. Actually, any bill will do, just pull it out and hold it in your hand, okay? Now for the big lie. The political party that controls Lansing right now tells us they will improve services by turning the entire system over to HMOs. The lie is it has nothing to do with quality and everything to do with money. What they really want is to reward their corporate benefactors, those who financially support their political careers. It's a huge cash cow payback. Now I know that statement may make some of you angry at me. And if it does, I willingly accept that anger. Because regardless of whether I'm right or wrong with my opinion, privatizing Michigan's mental health system will destroy it. Let me show you how. If you've got that bill out, look at it as a $10 bill that you willingly paid in taxes to help people in need. Now let's follow the money. Here in Oakland County today, one of those $10 goes to manage the system. After all, the state of Michigan can't just take your $10 and throw it out on a corner of Woodward and 13 and say, you know, anybody that needs it, come help yourself. $9 is left to help people like me and Pam and many people that we know of. Now look at that $10 bill again. After privatization, the Lansing politicians take it from your hand and hand it right over to a nonprofit HMO or a for-profit HMO. I'm not sure what the difference is, frankly. Quite likely that HMO will spend more than Oakland County to manage the system. Let's say $2 instead of $1. That leaves $8 to help those in need, right? Wrong. Don't forget profit. Probably around $3. $5 now remain. Half of the $10 bill that you gave in taxes to provide services for people like me is gone before one person is seen. It only gets worse. Since corporations need increasing quarterly profits, system-wide changes are inevitable. Reduce expenses, downsize, cut pay, eliminate benefits. It's already been talked about. As experienced and capable treatment staff become discouraged, demoralized, and depart, many will be replaced by struggling low-wage workers who sometimes arrive late, still wearing their McDonald's shirts. This will transform Michigan's mental health system from one which was as inclusive as possible to one which cuts services and excludes as many as possible. Politicians win, corporations win, we lose. Let me issue a warning. The politicians who control Lansing will use every trick in the book to accomplish the goal. They'll express immense concern and empathy over your every concern. They'll energetically appoint work groups, right? Investigative committees, write position papers, conduct hearings, hire outside experts. They'll arrive at early morning meetings with warm smiles, hot coffee, and chocolate-covered donuts decorated with colorful little sprinkles. They'll stroke your ego continually. Don't fall for it. They have only one goal: replace the existing mental health treatment system with one that enables them and their corporate benefactors to profit from every tax dollar you pay. We must oppose them at every juncture. Let our guard down and give them an inch, and they'll walk away with the entire yardstick. And all we'll have left will be a few colorful sprinkles on our cheek and an old chocolate donut. We must never let that happen. Never. Never.
Hello, my name is Rachel Kirchner. I'm from right here in Royal Oak. I have 3 children and a husband. He's still with me, surprisingly. And my 17-year-old and my 5-year-old are on the autism spectrum. My 17-year-old is your classic severely autistic kid, however very sweet and very happy, but teenage years have not been kind to him or the rest of us. And we're in an interesting position that we are stuck between both worlds. My husband has good insurance. The insurance does cover some services. With the advent of the insurance law, more services have been covered. But when we were in crisis, both systems failed us. We, as puberty increased, my 17-year-old's, his aggression increased. He took it out on everyone in the family except for the middle child, who is his beloved sister. She's a saint. She can do nothing wrong. He has never attacked her, but he has attacked everyone else in the family, including, at the time, my 5-year-old was 3 years old, and that was his primary target. After my son attacked me in the car, twice within 15 minutes, I had to pull over. This was 2 years ago, and I did what I thought I would never ever do. I called the police. He ended up here at Beaumont, and I actually have to say the staff here at Beaumont were the only ones that felt like they were on my side, but they couldn't do anything. None of the hospitals could take him, either because of his age or because he was too aggressive. He spent, I think it was 21 days here at Beaumont while my insurance company and Oakland County and Mork fought over who was responsible for helping him. He was in 4-point restraints for 21 days. We wanted him to go over to Great Lakes Treatment Center, which is in Kalamazoo, which is ABA based, but they also provide psychiatry and medicine if needed. And of course, they don't take private insurance, so whatever isn't covered by private insurance could be covered by Medicaid, because my son has Medicaid, but Oakland County wouldn't do it. Now, was that because general funds had been cut and they had less money, or was it because they don't understand what autism is and how to deal with a teenager with aggression? It does a number on kids. The result was that my son ended up spending 9 months in Hawthorne Center while we were arguing over could he go. And he ended up heavily medicated, and I think over-medicated. He's been home for a year, and we have been able to rely on private insurance to get ABA therapy. Finally, after years of not being able to keep CLS workers for more than 3 months, we've had one very good CLS worker for a year. But we shouldn't have had to go through 3 years of nothing to crisis point to get there. And now we're facing the fact that he's going to be 18. And I look at the group home options, and they don't look good. They don't seem to understand behavioral therapies, structure, consistency. I've never been able to keep a CLS worker for more than 3-4 months. The fact that I've had one for a year is an absolute miracle. But like most of the good ones, he's in school. He's getting his bachelor's degree. He has a plan to get his master's degree because he needs more money. We can't pay our CLS workers and our respite care workers less than they get paid at McDonald's and expect them to stay. And we also need to have people trained appropriately for the disability or the mental illness that they are helping. A general, well, let's give them all, bloodborne pathogens, recipient rights, and gentle teaching is not going to work across the board. We have to have people who are trained. We have to give our CLS workers benefits. We have to make this something that they're going to stay. My son is heartbroken every time he gets attached to someone and they disappear. He still talks about his favorite worker who he hasn't seen for 3 years. You know, we can't do this. We have to, if we want our kids and our adults and our mentally ill, if we want them in the community, we have to provide the structure. And in the case of my son, he may not be able to live in the community because he needs 24-hour supervision. Even when he's not being aggressive, he needs to be prompted to clean up the mess around him, to get dressed. He needs to be prompted to shave, to put on deodorant. This is exhausting. You know, we can't do this forever, and we have determined that if we can't find services, we will leave the state because other states do it better. And my suggestion to the legislator, look at other states. Look at what they're doing because this system is broken. We need more consumer choice, not less. The private insurance companies, they don't do a good job. They don't understand the intricacies of autism any more than the public does. You know, I've dealt with Blue Cross Blue Shield, and they have subcontracted their mental health for autism services to First Magellan and now New Directions. Neither one of them understand specifically the laws of what's going on in Michigan because I'm talking to people who are working out of Florida or working out of Arizona. And I say, okay, so we need to look at the system and we need to change everything. We need to have fewer layers, we need to have more consumer choice, and if we really want our vulnerable individuals to be in the community and not in institutions, we have to create the structure.
Please forgive me. My name is Karan Anderson, and I have been a Clubhouse member since January 7th, 2015. Through the Clubhouse, I have met people who work with me on meeting the challenges of moving forward in my life. I used to feel like I was an embarrassment. How could I be embarrassed about having a medical problem due to a stroke? My reading and writing skills went downhill all the way. I used to be a teacher's assistant at Los Angeles City College. I made the Dean's Honor Roll list 3 times. My grade point average was 3.8. Life no longer seemed to be worth living. I didn't do anything but watch TV and stayed in bed. My wonderful niece, Kimberly Kay, came over and got me out of the house. That was so depressing. She brought God back in my life. While attending Visions Clubhouse, I am able to try new and different things without being afraid of failure. I have learned to work in the coffee cafe, counting money, greeting members, and working in the kitchen, helping make the daily meals and dishwashing. I have also gained the courage to explore the computer and increase my typing skills. We have a media group that contributes to by being an anchor, a writer, or a weather person. With an increase of confidence, I have become a mentor to other new members. Joe is tall in stature. He scared me at first, but he has the friendliest eyes. He kept me going. Joe and I lead tours and orientation and make sure people feel welcome to our close-knit community. I know how overwhelming it can be when being a newbie. My case manager and Visions Clubhouse linked me with the service of Oakland County Adult Literacy Council. My tutor is named Paula, who is teaching me to develop new neuron pathways to give me the ability to read and comprehend after suffering from my stroke. She works with me on Mondays and Wednesdays from 9:30 to 10:30. Since working with Paula, I am improving my reading skills by 3 reading levels. This is actually my first assignment, and I am feeling so confident that I am sharing it with you all. Every day, I look forward to getting up in the morning and coming to Visions Clubhouse. I am concerned that changes in mental health funding will cause me to lose CNS and Visions Clubhouse. This would be detrimental to my progress and recovery. Right now, as of October the 1st, we are losing over 20 members in our program. I don't want to be lost in the mix. Thank you.
My name is Robert White. I'm here with my wife. We're parent advocates, as well as catalysts for the Parent Alliance of Metro Detroit. We have 2 sons, both on the autism spectrum, one age 46 and one 32. And they, along with 25,000 other individuals, are the reasons why we advocate. Tonight, my testimony is not a testimony more, it's an appeal. And the appeal would be to maybe 3 different groups or 3 different in areas. My first appeal would be to legislators and policymakers, in that start out with a statement that none of us are blameworthy, but we're all responsible to change what's broken. So, sometimes it's easy to look and find what's broke with the current system. It's more difficult to really have input constructive as to how to fix it. So I'm going to, instead of privatization, let me just call it outsourcing for a minute. Because we outsource community mental health today. The department does and the state does, right? We outsource it to CMHs and PIHPs. So privatization, or taking it one step further to manage health cares, is 100% outsourcing. So any outsourcing, let's say, project that I have been involved in professionally, you have got to make sure that if you're going to give up your core competency, that you don't end up at some point in time with what I'll call scorched land, with none of the managed healthcare organizations still with you because they took the cream off the crop and they left. Now you have no infrastructure. You've lost your core competency, and you've created more vulnerability and risk than you ever thought imaginable for a population or populations that are the most vulnerable that you represent. So when it comes to privatization or outsourcing, I could easily understand why a department or a governor might say, wow, what a great way to get rid of risk. You know, we can outsource that risk. Our problems with how to fund wages goes away because it's no longer our problem. We've outsourced that as well. And so that might be pretty attractive. But I challenge not only you, I applaud you for being here, but also your colleagues, and certainly those that sit on the Appropriation Committee, both in Senate and in House for Health and Human Services. One of the requirements that I would think there would be is that to sit on one of those committees, you would, before that, really understand and go out to independent living settings, go out to group homes, go out to voc centers, go out to skill building centers, and really find out where that little yellow bus with the chairlift that goes through your subdivision goes, and the population that's impacted every single day. So my appeal to you is, we understand and we hear that decisions in this administration are evidence-based. I see no evidence. I see no evidence that says that managed healthcare organizations can take on the complexity that's represented today in this. And I urge you also, through your colleagues, one of the recommendations that might come back from this current work group is that let's do some pilot programs. To me, that's a cop-out. We have pilot programs running today that are funded in Macomb and Detroit, Wayne. Nobody's even learning from those programs. So yet it's the answer. Let's start another pilot or a demonstration program. I would submit my appeal to you. Learn from what we're doing today, but that's not working. I mean, those programs aren't flourishing. Well, why? Because there's a lot of bridge that would overlap what we're suggesting in terms of turning over the mental health and the funding to HMOs. So that's another appeal. Please, a pilot even is a risky situation. And I don't feel we can learn in this area. You can't launch a learning curve that on the population at risk that we're talking about. You can't do that. You've got to get it right. So don't rush this process. When I hear a deadline of October 15th or the end of October, it just makes me boil. We have got, because of the work of the first work group, we've got a set of design principles and core values that are the starting point for redesign. So it's not like we're starting from nothing, but there was an effort and initiative to throw that all away and say, well, you know, let's start fresh, because it really wasn't what we wanted to hear. Now, we're not delivering to those design requirements and principles today. So what the hell makes us think we're gonna, you know, systematically do it by outsourcing it? Okay?
Let's bring it to close.
Okay, so that's my appeal to the legislators. My appeal then, I would go to local CMHs and PIHPs and the provider network and local government. We need to band together. We need to band together and provide what we feel is a solution. Because sure as heck, the Meridians and the Blue Cross Blue Shields are going to waive their solution in front of a legislative, administrative that's looking for a quick answer. So I urge and appeal to the current system and those that have impact. Let's band together, and I'm part of that. All the advocates are, the parents are, and let's come up and present what we feel is a solution. Otherwise, we're going to have to live with their answer, which may not be good. And lastly, Fred, just 1 minute. You know, I appeal to the parents and the advocacy and what you can bring to a solution. It's the worst paying job that I've ever had. It is long hours. The needle hardly moves at the end of a day. And I keep looking at the picture of our 2 sons, and it reminds me why my wife and I do it. And I urge you to keep up too. Thank you.